First, I was very honored to have been recognized by Sangamon County Medical Society for the Medical Innovators Award. The work we did was largely with a clinical database in patients with hypertension, mostly, though not exclusively, African American, who were coming to us for care, and we assessed their vitamin D status before we started treating them, and really made several observations I think that are important. One is that over time, when people's vitamin D levels were very low, if you gave them vitamin D over and above the blood pressure lowering you got just from drugs, you got additional blood pressure lowering with vitamin D. Somewhat unexpectedly, though, we found that in the same group of people who really had very low vitamin D levels, over a period of about 5 to 6 months, they lost just under 5 pounds in body weight. And physiologically, this makes sense because there are cellular pathways that get up and down regulated that cause you to maintain fat, accumulate fat when your vitamin D levels get low. And so at least in African Americans, we demonstrated over about a 6-month period of time both a positive blood pressure response and a reduction in body weight that occurred with high-dose vitamin D supplementation, and that was 2,000 units a day or more. Well, this project's innovative because we challenged the long-held paradigm that your vitamin D level was low because you were overweight or obese, and we said, well, that's probably true, but it also works in the other direction. Low vitamin D level contributes to you being overweight and obese. We also were able to show in a clinic population that vitamin D administration in people with low levels actually lowered blood pressure above what we could get just with blood pressure drugs. And the third thing that was innovative is that's not just giving vitamin D to everyone, it's giving vitamin D to people who truly have low levels. The Institute of Medicine really has established a threshold of 20 nanograms per ml. What we actually found was that where we saw benefit was actually 5 nanograms per ml, lower than that at 15 nanograms per ml. So those who were like 15 to 20 got a very small benefit on their blood pressure and on their body weight as far as reduction in body weight, which we're presuming is pretty much all fat, because when you become vitamin D deficient, one of the things that happens is your muscles shrink, you get atrophy, and this is called a subclinical myopathy, and even biopsy studies have shown that the muscle fibers just get physically smaller. So with vitamin D deficiency, when you gain weight, you're also losing muscle mass, and when we give vitamin D, very likely we're building muscle back up while we're dropping fat. Well, going forward, we're going to try to understand more about the ways that vitamin D actually interacts with individual attributes. So, for example, we're getting ready to undertake some studies with a very sophisticated body composition machine that will tell us percent fat, lean muscle mass, the amount of protein in the body, basal metabolic rate, and we're going to start trying to tease out the factors that predict whether your response to vitamin D, even when you're low, is either greater or lesser. And also, too, even try to identify people based on their individual characteristics who, when their vitamin D levels over 15, may respond, but it may not show up in the group average. So we're moving more towards what some people call personalized medicine, where we integrate larger databases than we typically get just from clinical practice, and we're going to try to use those to ultimately inform clinical practice where we can actually isolate the greatest opportunity for benefit. Well, whenever I do clinical work or research, the goal is to try to improve human health and to figure ways to help people either treat their risk factors better, become healthier, have a lower risk for heart disease, vascular disease, stroke. So the fact that this therapy is widely available, cheap, safe, and effective, to me gives me a great deal of satisfaction, because a lot of the problems linked to vitamin D deficiency are rampant in the African American population: hypertension, diabetes, overweight, obesity, And just even vitamin D deficiency itself, again, is in 2/3 of the free living U.S. population who are black. I think this research has implications beyond the African American community, but it is most specifically, the findings I've been talking about are most specifically linked to the black community. But vitamin D deficiency is fairly prevalent even in non-African Americans in the United States.